Hello everyone, in today's lecture we'll speak about bronchiolitis in children. So bronchiolitis is a viral infection that will affect the lower respiratory tract, and it will involve inflammation, edema, and we will have also mucus plugging of the bronchioles, and this will lead to airway obstruction. So the etiology could be viral, bacterial, or environmental. The most common one is the viral infection. It can be caused by respiratory syncytial virus, influenza virus, adenovirus, rhinovirus, and human metapneumovirus. Other factors can be bacterials or environmental, like cigarette smoke, pollutants, dust, or any environmental triggers. Pathogenesis. So we will have the viral. If the viral will infect the bronchial epithelial cells, this infection will lead to an inflammation. The inflammation will lead to the release of cytokines. The cytokines will increase the permeability of the cells, and this will lead to an edema. And eventually, we'll also have an increase in the mucus production, and all the edema and the mucus production increase will lead to the narrowing in the bronchiolitis, and this will do a problem in the gas exchange function, and this will lead to our symptoms. So for the physical examination, from the general appearance of the child, we will see that he's distressed. We can see cyanosis, and we will see that he's poorly fed. The vital signs will have tachypnea and possible low-grade fever. In the auscultation, we will listen to a diffuse expiratory wheezing and crackles, decreased air entry in some areas. In the percussion, we will have a hyperresonance due to the air trapping and dullness in the areas of atelectasis. For the laboratory instrumental studies, the lab test CBC will show a mild lymphocytosis, significant like leukocytosis for the bacterial infection. CRP ESR will be very high in bacterial infections and normal or mildly high in viral infection. Procalcitonin, it will be more than 0.5 in the bacterial infections and less in the viral. The normal is 0.1. For the instrumental studies, we'll do a chest X-ray. We can see hyperinflation. We already spoke about hyperinflation and how to know it. Pre-bronchial coughing and patchy atelectasis. For the pulse oximetry, it's important so we could know the oxygen saturation. And we will also do a blood gas analysis in the severe cases to see if we have any respiratory acidosis. Now let's speak about the atelectasis. So what is it first of all? So it is small irregular areas of lung collapse where the alveoli are partially or completely deflated. It often occurs due to mucus plugging, airway obstruction, or poor ventilation. And this could be seen in bronchiolitis, pneumonia, or post-surgical states, and respiratory distress syndrome. So how to identify it? So first of all, we have a patchy opacities. The opacities are increased whiteness in the place. And this is the first thing that we will notice as we see in the picture. For example, here we see that they have an increased opacity. The second thing, there's some indirect signs. So for example, a shift of the trachea to the affected site. Look at the trachea. It's shifted to the affected sites. Elevation of the diaphragm of the affected sites. For example, here, look at the diaphragm. This is the other diaphragm. Look how it's elevated. Look how it's elevated. Okay, we can have crowding of the ribs due to the reduced lung expansion. And we have liner or plate-like atelectasis. So now in this one, we have a shift in the trachea. Here all is opacities. So we have atelectasis here with other things, of course. Here in this picture, where is the atelectasis? This is the one we talked about, the liner or plate-like atelectasis. So here it is. In this one, where it is? Here, and this is the lung. The treatment approach. So first of all, you do an oxygen therapy to maintain the oxygen saturation more than 94 maybe, and ensure adequate hydration and nutritional support, and nasal suction to clear the secretions. Pharmacology interventions, we know that this is a viral infection, so supportive management is the most suggestible treatment. So all these drugs or interventions are like controversial benefits. So maybe we use them, maybe we won't. So maybe just take a look at them. But if you tell your teacher, hey, viral infection, supportive treatment, symptomatic treatment, you're perfect. And that's actually all and everything for today's lecture. I hope you liked it. Thank you so much for watching and see you in the next lecture. Goodbye.